I first started having symptoms of incontinence probably about 20 years ago. Of course, it starts out a little cough or a sneeze or stress, and you don't really pay as much attention to it at the beginning, but of course it gets progressively worse as time goes on. Pad use starts out small, like one a day, until eventually you're using every couple hours. You have to change because the symptoms just get worse and worse.
So SUI, or stress urinary incontinence, the most common thing that people will complain of is I sneeze or I cough or I start laughing and I leak urine. For some people, it's I'm exercising, I'm at the gym, I'm halfway through my workout and I start leaking urine. One of the most common questions I'll ask patients is, if you're going to do a jumping jack, will you leak urine? And if the answer is yes, then that's stress incontinence.
Incontinence at work is always on your mind because you're busy, you're running all day, you end up feeling this, and you have to make sure that you're able to be in a spot that you can change and take care of the issue. My mental health, it was extremely frustrating, really, knowing that this is constantly happening to you and everything you do revolves around being able to be near a restroom or being able to change pads or, not leaking and having wet spots on your pants. It's very frustrating and embarrassing.
I have a lot of patients that are nurses. They refer to themselves as having quote unquote nurses' bladders. I have patients that are teachers. They hold their bladders all day long because God bless them, they're teaching future generations. I really want women to talk about this. I think that leakage and pelvic floor issues are not talked about nearly enough. And it's a common problem. Such a common problem. And the fact that we're not discussing it with the women in our family, the women in our friend groups, the women in our church, the women in our home, the women at our workplace, it's a crime. It's a crime to our gender, especially because women need to be able to talk about it, and they need a place to go to talk about it, and they need options. And if they have options, then they're able to help themselves. And I think that that's where we can make a big difference in this community.
Every day I would have symptoms. Again, over time they got worse. I did see a doctor. That was around 2006 probably. And I had the urodynamics test and we discussed doing the procedure, but I changed jobs, life got in the way, time went on, and finally it just got so bad I couldn't deal with it anymore. So that was, 10 years probably in between the first time and when I saw Dr. Zell.
The surgical treatment options for stress incontinence include the more well-known type, and that is anything that's going to strengthen the pelvic floor musculature, which usually includes the name sling somewhere in the title.
I decided to get the sling procedure for quality of life. It has been life-changing.
The sling is considered a very long-lasting treatment for stress incontinence. It is considered a surgical implant. So like breast implants or a pacemaker, essentially it's with you for life.
The day of my surgery was so easy. Got to the surgery center, they set you up. Dr. Zell did the procedure, came out, offered me pain medicine. I didn't feel like I needed pain medicine. I was really having no pain at all. I was in and out of the surgery center in about probably 2.5 to 3 hours. Left, went, took a nap, woke up, I felt great, and the results were immediate, literally immediate, the results from the procedure.
The single incision sling is amazing. It is a very quick procedure. When I tell patients it takes 10 to 15 minutes, I'm not being a liar or facetious. It literally takes 10 to 15 minutes. It is one small incision in the vagina. The actual size of the incision itself is 1.5 centimeters in length at the level just underneath the urethra. One small incision, very small amount of dissection. The sling goes in. The incision is closed. The recovery time is short and very manageable.
The recovery was, for me, easy. The biggest drawback was not being able to lift. I believe it was like 7 or 8 pounds for a couple weeks you couldn't lift, but other than that, I used ibuprofen if I had any discomfort, which I only used it maybe 2 or 3 times, and I did stay out of work for 2 weeks because of lifting and that sort of thing, but it was easy. I did not have any problem with the surgery and the recovery.
I want all of my patients to do everything they felt they couldn't do when they were leaking. Whether that means exercising, jumping on a trampoline, running a marathon, swimming laps in the pool, having sexual activity, anything that makes them happy that they want to get back into.
Since the surgery, I have freedom. I'm dry, honestly. I don't have to worry about being near a restroom all the time. I don't have to worry about being able to go out on the boat or be out running around with, hanging out with friends. I waited 10 years. Do not do that. Help is there.
It's really, really wonderful as a surgeon to see patients that feel so much better in such a short time span. And you really feel like you're making a difference in these women's lives.
I'm getting ready to go to Greece in September, and not having to make sure I have a month's worth of product with me is pretty refreshing. And being able to, we'll be doing hiking and that sort of thing, so being able to travel freely like that is very refreshing. I'm really looking forward to it. And I do like to shop, and one nice thing about that is you can try on clothes now without, oh no, I can't try those jeans on because, I'm not sure my pad's dry and clean and whatever. Now I can just hold something up and say, I think I'll go try that on. As a nurse, I obviously encounter women with the same issue. I do speak to them about my experience and how life-changing it has been for me, and try to refer them to someone who can counsel them on the procedure and see if they're a candidate for it. And the patients that have come back that I've spoken with, they've always been very positive about their experience and how they feel about the possibility of maybe doing the procedure. It's life-changing.